Hi, I'm Dr Mani Naghibi, consultant gastroenterologist at Clementine Churchill Hospital in Harrow, northwest London. Today, I'll be sharing my expert knowledge about having a gastrointestinal endoscopy, which is a procedure to look inside your digestive tract. It is used for diagnosis but can also be used to treat certain conditions. First things first, what is an endoscopy? An endoscopy uses a camera mounted on the end of a flexible, thin scope that goes inside your body to take high-quality pictures or videos. We use them to screen, diagnose, and treat several conditions. Endoscopy is used by other specialities too, such as lung specialists, kidney specialists, and gynecologists. Today, we will be talking about endoscopy of the digestive tract. What is a gastroscopy? A gastroscopy, also known as an upper GI endoscopy or OGD, is a procedure to look inside your esophagus, food pipe, stomach, and the first part of your small intestine. Why might you need a gastroscopy? A gastroscopy is a highly effective way of investigating a broad range of upper GI tract problems. You might benefit from a gastroscopy if you are experiencing one or more of the following symptoms: heartburn and indigestion, bloating, stomach pain, nausea, difficulty swallowing, abnormal bleeding, and low levels of iron in your blood, also known as iron deficiency anemia. These symptoms can be caused by many conditions. For example, stomach ulceration, which is a sore that develops when acid damages the lining of your stomach. Increased acid in the upper GI tract can also cause gastroesophageal reflux disease, which your doctor may choose to investigate with a gastroscopy. Gastritis is a common condition with a wide range of causes, including H. pylori, which is a bacteria that can irritate the lining of your stomach. A gastroscopy can be used to diagnose H. pylori and guide its antibiotic treatment in resistant cases. You may have heard of celiac disease, a condition causing digestive problems when the digestive tract is exposed to gluten. The diagnosis and surveillance of celiac disease involves biopsies taken at gastroscopy from the small bowel. What happens during a gastroscopy? A gastroscopy usually takes around 5 to 15 minutes, but this can vary depending on your circumstances. To begin, you will lie on your side. Your gastroenterologist will apply a local anesthetic spray to numb your throat. You will also be offered a sedative for the procedure, which will help you relax during it. This will be administered intravenously, which means through a tube placed in your vein. You will also be offered a mouthguard to protect your teeth. Your doctor will then gently insert a thin, flexible tube with a light and camera at the end of it down your throat and into your upper GI tract. This camera will be connected to a monitor in the room. During a gastroscopy, air will be blown into your stomach after the endoscope has been inserted, allowing your consultant to see any abnormalities. This may feel a bit uncomfortable, make you burp, feel bloated, but it will improve by the end of the procedure. What is the recovery period like? You can leave hospital soon after the gastroscopy. If you have sedation, you will need to wait in the recovery room as you recover and arrange for a friend or family member to collect you from hospital while your sedative wears off. After the gastroscopy, you may have a slightly sore throat. This can last for 1 or 2 days, but can be effectively managed with over-the-counter painkillers like paracetamol. You should rest and drink plenty of fluids the day after the procedure. Most people recover quickly after a gastroscopy and can return to normal everyday activities within 1 day of having the procedure. What is a colonoscopy? A colonoscopy is one of the most common procedures used to diagnose bowel problems. The procedure looks inside your large bowel, also known as your large intestine, using a thin, flexible tube called a colonoscope that has a light and a camera at the end of it. This tube will be passed around your large intestine to look for the cause of your symptoms. Some air will be blown into your bowel to open it up and help your consultant see things more clearly. Why might you need a colonoscopy? A colonoscopy is most often performed to check what might be causing difficult bowel symptoms such as anal bleeding, blood in your stool, long-term diarrhea or constipation, sudden or dramatic weight loss, anemia, known inflammatory bowel disease, or colonic polyps. There are several digestive conditions that a colonoscopy can help to diagnose. These include Crohn's disease, which is a long-term condition that causes parts of your digestive system to become inflamed. It can cause severe stomach pain, diarrhea, weight loss, and even malnutrition. Ulcerative colitis is another inflammatory bowel condition related to Crohn's, and colonoscopy plays an important role in its diagnosis and surveillance. Colonoscopy can reliably diagnose colonic diverticula, which are small bulges in the lining of your intestine. Colonoscopy also plays a major role in diagnosing colonic polyps and cancers. Most polyps are harmless, but some have the potential to develop into tumors containing cancerous cells. What happens during a colonoscopy? Colonoscopy usually takes between 20 and 30 minutes. You will need to take a laxative the day before your appointment to empty your bowel so that your consultant can see inside clearly. You will be offered a sedative for the procedure, which will help you relax during it. To begin with, your doctor will ask that you lie down on your left side with your knees brought up to your chest. They will then pass a thin, flexible tube with a light and camera at the end of it through your bottom and into your large bowel to examine the cause of your symptoms. They will blow air into your bowel to open it up and see more clearly. What is the recovery period like? You can leave hospital on the same day as the colonoscopy. You might feel bloated or have stomach cramps for a few hours after. You should rest and drink plenty of fluids the day after the procedure. Most people recover quickly after a colonoscopy and can return to normal everyday activities within 1 day of having the procedure. We hope this video provides you with the information you need to understand these procedures a little better. If you have any questions, feel free to leave them in the comments section below this video. If you would like to arrange a consultation with me or the nearest consultant in your area to discuss an endoscopy in even more detail, you can book an appointment at circlehealthgroup.co.uk.